Mary Stephen, welcome to WHO Africa Media Briefing, which is taking place in collaboration with the APO Group. First, some housekeeping. Please go to the globe and select the language you would like to listen to the press conference in. François?
Bonjour à tous et merci de vous être connectés pour cette session. Pour sélectionner la langue dans laquelle vous souhaitez entendre la conférence, vous pouvez cliquer sur l'outil d'interprétation de Zoom qui ressemble à un globe et choisir votre langue. Et pour vos questions, merci d'utiliser l'outil de QNR qui est intégré à Zoom, pareil dans la barre d'outils. Merci à tous.
Thank you, François. Joining us today for this press briefing is Dr. Matshidiso Moeti, the WHO Regional Director for Africa from Brazzaville, and Dr. Moeti will introduce our other panelists. Over to you, Dr. Moeti.
Yes, thank you very much, Mary, and greetings to everyone joining this press conference today in the lead up to the African Vaccination Week, which starts this Saturday. This is a chance to celebrate the lives saved and illnesses averted through vaccination, which is one of the highest impact and most cost-effective public health tools. I'm very happy to be joined for this conversation by Dr. Edwin Dikoloty, the Honorable Minister of Health and Wellness of Botswana, who can tell us about how routine immunization has improved the health and survival of children in that country. A warm welcome, Honorable Minister. And also to be joined by Dr. Austin Dembi, the Honorable Minister of Health of Sierra Leone, where the Johnson & Johnson Ebola vaccine is about to be rolled out. A warm welcome to your Minister as well. There have now been more than 4.5 million COVID-19 cases on the African continent, and sadly, 118,000 people have died. We're still seeing altogether a plateau at around 75,000 new cases a week, with an upward trend, though, in 12 countries in recent weeks. So this year, you've heard me advocate for the speedy and equitable rollout of COVID-19 vaccines on the continent. The African Vaccination Week is a key moment also to push for crucial immunization campaigns against diseases like measles, polio, and yellow fever. For instance, 15 African countries delayed measles immunization campaigns last year as they dealt with the COVID-19 pandemic. While 7 of these countries have now completed the campaigns, 8 remain outstanding, posing a risk of outbreaks. Preliminary data shows that an estimated 16.6 million children in Africa missed planned supplemental measles vaccine doses between January 2020 and April 2021. As we fight COVID-19, we can't leave anyone dangerously exposed to other preventable diseases. We have high hopes that vaccines will help bring the COVID-19 pandemic to an end. Last year, we celebrated the historic milestone of Africa kicking wild polio virus out of the continent. Vaccines were pivotal to this. Routine immunization has played a vital role in improving child survival, contributing to halving the death rate of children below 5 years of age in sub-Saharan Africa in the past 20 years. So far, 19 African countries have achieved the benchmark of at least 90% of coverage of diphtheria, tetanus, and tetanus pertussis, or DTP3 vaccine. This is the key indicator used to assess the performance of routine immunization programs. However, at the regional level, for the past 10 years, the DTP3 coverage has stalled at between 70 and 75%. Every year, an estimated 9 million children in the region in rural and urban areas miss out on routine vaccines. 60% of these children are living in Nigeria, the Democratic Republic of the Congo, and Ethiopia. To reach every child with vaccination, countries need to address challenges of inadequate infrastructure, transport and power supply, limited frontline healthcare workers, and stockouts of vaccines and other essentials like syringes. Children in poorer families and those living in areas of conflict or prolonged humanitarian crises also miss out. African heads of state have shown their commitment to enhancing universal health, universal access to vaccines through the Addis Declaration on Immunization in 2017. To maintain this momentum, increased domestic investment is needed with support from partners to strengthen immunization programs as part of primary healthcare systems in countries. This should be backed by sufficient numbers of trained health workers and functional surveillance and health information systems with engaged communities and caregivers and attention to children living in the most difficult circumstances. The COVID-19 pandemic has dramatically highlighted the enormous value of vaccines. In the United States, for example, among 75 million people fully vaccinated against the virus, fewer than 6,000 COVID-19 cases have been reported. Vaccines are bringing us closer to ending this pandemic, and the faster they can be rolled out in African countries, the sooner our economies and societies can recover and build back better. This includes investing in capacities in Africa to manufacture medical products like vaccines to enhance our self-reliance. Although there are delays in shipments through the COVAX facility, 7 African countries received their first deliveries last week. This brings the total to 41 countries in Africa that have received over 80 million doses through the COVAX platform. However, I'm concerned that 7 countries have now used up all of their COVAX doses and will need to receive follow-up doses from early May to mid-June. WHO and COVAX partners continue to engage in intensive negotiations to ensure that African countries will get their second doses of the vaccine in a timely manner. We also encourage countries that have not been able to use their doses and high-income countries that have vaccinated their most at-risk groups to share their supplies with a few remaining countries that have not yet received a shipment. On a different note, we'll commemorate World Malaria Day this Sunday. The WHO African region accounts for 94% of global malaria cases and deaths, despite significant progress made in the past 20 years. In 2019, there were still more than 215 million malaria cases and 384,000 deaths in the region. Malaria wreaks havoc on our societies and economies, and it can be prevented by controlling mosquito populations and using insecticide-treated bed nets. Ensuring early access to testing and treatment is also crucial. To accelerate progress towards zero malaria, governments should invest in outreach services and training of community health workers to provide care for malaria, pneumonia, and other common illnesses. Innovations will also be critical. So we're excited that Ghana, Kenya, and Malawi have delivered more than 1.7 million doses of the RTSS vaccine. This is a promising additional tool in malaria prevention. COVID-19 has shown that we each have a role to play in combating infectious diseases, and I ask that we use this learning in the fight against malaria and vaccine-preventable diseases. Finally, in closing, I'd like to congratulate the Gambia for receiving WHO certification of the elimination of trachoma as a public health problem. This shows the impressive work underway to address other priorities, even as we respond to COVID-19. So I'd like to thank you again, honorable ministers, my fellow panelists, and our journalist colleagues for joining us, and I look forward to our conversation.
Thank you, Dr. Moeti. And now we will turn over to the Honorable Minister of Health in Botswana to tell us about progress on routine vaccination in Botswana. Over to you, Honorable Minister. You are muted, Honorable Minister. Can you please unmute your microphone? Thank you, sir.
Is it, I'm the Minister for Sierra Leone, so I'll wait for my colleague from Botswana to go first. That's okay.
Oh, okay. This is the Minister for Sierra Leone. Dr. Austin, welcome, sir.
Thank you.
Okay, so before we get the Honorable Minister for Botswana, I will turn over to you, Honorable Minister, Dr. Austin. Can you please tell us about the Ebola vaccine rollout in Sierra Leone?
Thank you very much. This is a really special day, and it's really great to see Dr. Moeti after all these years. I'm really happy to reconnect with you. I'll make some formal statements, and I really look forward to the deliberations at the end. In the last week of April for every year since 2001, African countries joined the WHO Afro to celebrate African Vaccination Week. The African Vaccination Week celebrates people who develop, deliver, and receive vaccines as heroes, contributing to protecting everyone everywhere. Never has this been clearer than in the ongoing COVID-19 pandemic. In 2020, as most countries remained in lockdown, routine and campaign activities were adversely affected due to the physical distancing and movement restriction measures. Vaccines have saved humanity from very serious infectious diseases over the years. When countries increase access to immunization, it not only saves lives and improves health outcomes, it also unlocks the social and economic potential of the population. To protect communities from vaccine-preventable disease outbreaks during these unprecedented times, it is important that countries maintain routine immunization services using innovative approaches and with strong infection prevention control practices in health facilities. Vaccine-preventable diseases are one of the major causes of morbidity and mortality, especially amongst children. The fact that the WHO in 2020 declared African region wild polio virus free is an inspiring sign that vaccines really do work. Immunization coverage in Sierra Leone has improved steadily in the past 5 years before COVID-19 outbreak, and in 2020, Sierra Leone passed the MCC indicator for immunization with coverage of 95% for Penta 3 and 93% for measles 1. With a good coverage of routine immunization in Sierra Leone, we have gone as a country for a number of years without major outbreaks of vaccine-preventable diseases such as measles and yellow fever. Of note also is the major drop in the incidence of diarrheal diseases among children under 5 years, which could be attributable to the role of vaccine immunization. And we have no doubt it's contributed to the modest reduction in under 5 mortality from 156 to 122 per 1,000 live births. Despite the gains that have been made in immunization coverage over the years, the COVID-19 pandemic has led to adverse effect on vaccination coverage across the country. The Western Urban District, where the capital Freetown sits, has been the most seriously affected district in the country. With all eyes focused on COVID-19 vaccines, other crucial vaccination commitments must not be forgotten. For now, more than ever, we need strong partnerships and greater financial commitments to achieve universal access to immunization for all Africans, including Sierra Leoneans, and everyone has a role to play. Sierra Leone has successfully launched with about 4,042 confirmed cases of COVID-19 and 79 deaths. Sierra Leone has successfully launched and initiated COVID-19 vaccination across the country. So far, we have had up to 51,000 people receiving the first dose of COVID-19 vaccines, and about just under 5,000 have received the second dose. In this case as well, the scientific consensus across the world is that vaccination is one of the key strategies to bring this outbreak under control. In response to the Ebola virus outbreak in Guinea, Sierra Leone is taking many steps to prevent the spillover of the infection to Sierra Leone. Sierra Leone is sending teams to work with their Guinean counterparts to put the outbreak under control. Sierra Leone has also established very robust surveillance systems to ensure that any suspected cases are detected, investigated, and reported early. Robust behavior change communication interventions are also being implemented to ensure that there is heightened community awareness about the disease and its prevention. One of the strategies that's been deployed in Sierra Leone is the vaccination of healthcare workers in border districts, as well as commercial bike riders and traditional healers. We have already received close to 5,000 doses of the Johnson & Johnson vaccine. Micro-planning exercises have ensued, and the national vaccination supervisors are currently being trained. The vaccination teams in the districts will be trained during the week of the 25th of April, and vaccination is expected to start by the second week of May. We remain grateful to WHO and Johnson & Johnson for providing these vaccines to Sierra Leone to be used on compassionate grounds. In collaboration with our partners, we're committed to continue to improve on immunization services in the country in fulfillment of His Excellency President Julian Maada's vision of strengthening human capital development by contributing to a healthy and therefore a prosperous and productive nation. Thank you.
Thank you, Honorable Minister. Can we now have the Honorable Minister for Botswana? Okay, we seem to be having problem with the Minister for Botswana. So now that we have heard from our two panelists, it is over to you now, journalists, to ask your question. And to do this, you need to tell us your name, the name of the media organization you represent, and you can use the Q&A function on the Zoom application. We also have on hand Dr. Ambrose Talisuna, the Program Manager for Emergency Preparedness, Dr. Fiona Atehube, Vaccine Introduction Officer, and Dr. Tiano Balde, the WHO Team Lead for Operational Partnership, to also answer your question. So we are turning straight to our first question, Naftali from Shinwa.
Yes.
Okay, go ahead, please.
My question goes to Dr. Moeti. I just want to know from Dr. Moeti, is it possible for Africa to achieve the 20% vaccination target at the end of this year, given the surprise challenges that the world is encountering now on AstraZeneca vaccines?
Yes, thank you for that question, which is at the top of the minds of all of us. We have indeed seen African countries encounter production limitation related delays in acquiring their vaccines. And however, so far, we've seen 47 African countries having received 34.7 million vaccines. And from the COVAX platform, 41 countries have received 18.3 million doses. We have the delays are largely due to production capacities. I think everybody's aware of the challenge that India is facing with a severe wave of the pandemic, and decisions that have then been taken to focus on catching up vaccinating the population there. However, we are in constant communication, at least our representatives, both in the region and at headquarters within the COVAX partnership, with the Serum Institute of India and with the Indian government. And my understanding is that they are undertaking, starting from early in May, to resume their supply to African countries. And we anticipate being able to catch up, because we also see that there are plans to expand the production capacity in various places at the beginning. So we are very hopeful that we will reach the 20% coverage at the end of this year through COVAX. I'm very pleased as well at the way in which the countries that have received the vaccine doses have rolled out the delivery of the vaccine. Some of the countries have gone extremely fast. There are several that have already used up all the supplies that they received. And I'm very encouraged by the kind of micro-planning that's being done in our countries, and confident that whatever vaccine is received is going to be delivered to the population.
Thank you very much, Dr. Moeti. Now I'm turning over to Rhoda from BBC Africa. Over to you, Rhoda.
Thank you, Dr. Stevens. My question is to Dr. Moeti. I have two questions. Yesterday, Kenya's health minister hinted at the possibility of mixing COVID-19 vaccines. Is this advisable? What are the implications of this? And are there ongoing studies on the continent in regards to mixing of COVID-19 vaccines? And my second question is looking at what is happening in Malawi and South Sudan, that they're planning to destroy COVID-19 vaccines that have expired. Following the advice from the Serum Institute of India, the Africa CDC says that these countries can still use the vaccines 3 months after the expiry date. Does the WHO share similar sentiments? Thank you.
Okay, thank you. Thank you for those questions. I think first to the question of mixing vaccines, this is something that is still being studied. I know that in the UK, there is a study going on to see if it's possible to mix vaccines. So at the moment, we're not able to provide any definitive advice, but we imagine that if it's vaccines of a similar technical platform, it could be possible to use them one after the other. I think it's also got to be considered whether vaccines of different platforms could be used as boosters. So for the moment, we are looking to understand the data from some of the analyses and the studies that are going on this question. Indeed, with regard to the destruction of vaccines, these are newly developed vaccines. Even the expiry date is under study because the data continues to be progressively looked at and studied by the producers. So our advice, and we are aware that the SI has indeed given information indicating that the expiry date of, as initially thought out, could be longer. So our advice would be for the countries to ensure that they store the vaccines safely, and we continue to study and try to get the definitive advice on whether the vaccines could be used for longer. I would agree with the head of the Africa CDC. Is my understanding is that the expiry date could be several months longer than had initially been envisaged, but we will look for the definitive information and communicate with the governments through our country teams. We were in a meeting yesterday with our country representatives, and we provided that guidance that it is better to safely store the vaccine stocks, and then we will advise as soon as it's possible as to whether they can be used or not.
Thank you, Dr. Moeti. The next question is from Pamela Mawanda from Uganda. Her question is also similar to Rhoda's question. I'll give this question to Dr. Fiona. In light of the vaccination week, a number of African countries have reported having expired COVID-19 vaccines. Most of these vaccines were donations from the COVAX facility. What is the lifespan of the vaccine, and do you think the expired vaccine heightened vaccines hesitancy? Over to you, Fiona.
Thank you very much, Mary. And as Dr. Moeti has mentioned, yes, when we have new products that have been manufactured, usually there's a limited shelf life that they are given. And this is what happens with the vaccines, with the COVID-19 vaccines, because we did not have a precedent. They were given a 6-month shelf life, the particular ones from Serum Institute of India. But after the vaccines have been manufactured or any other medicinal product, studies keep on going to see how stable will this product remain, or how robust will it still remain to function the way it is supposed to function after the shelf life of 6 months that has been given. And that is what happened with the Serum Institute of India. So this has been now tentatively extended to 9 months. We have had issues. The difference was that the fact that these vaccines were already in country and already had a label. But the government of India, the National Regulatory Authority of India, did approve after getting all the evidence from Serum Institute of India for the extension of the shelf life. And the government of South Africa too did do this. However, we must note that the Serum Institute of India also applied to World Health Organization to request the extension of shelf life. The World Health Organization has requested for more information on this, like Dr. Moeti mentioned, to make that decision, to help countries make that decision. So we have asked the countries, put aside the vaccines. In the meantime, as the national regulatory authorities of the countries make that decision, but also as WHO studies more information on this.
Thank you, Dr. Fiona. The next question is to you, Honorable Minister of Health, Sierra Leone, Dr. Austin. Sierra Leone was one of the countries that benefited from the AU vaccine donation. What was the country able to administer the vaccine doses before the expiry date? And what was the experience? This is from Peter from BBC.
Well, thank you very much. I think that is a very good question. Sierra Leone is very grateful to receive the vaccine donation from the AU. Unfortunately, the shelf life for the vaccine was 1 month. And so we had to scramble to make sure that we utilize or prioritize the use of these vaccines in country. It's very likely that we will not be able to use all of them in time for the expiration date. So I think we may have like a third of it unutilized because of expiration concerns. But I think as a community, we have to realize that it took a while to convince people. So it's not just vaccine hesitancy, it's like vaccine skeptics to start with. And so it took a while to convince these people to take these vaccines. And I think for us in Sierra Leone, it took the president to go out there and be the first to be vaccinated. And not only that, all of the cabinet ministers, all of the political leaders to be vaccinated, to convince people that this was actually of benefit to them. And so if there's any change in the protocol, it's really going to be important to invest a lot in communication so that people understand not only the regulatory side of it, but the science of it in layman's terms. Why is it possible to be able to say you have a shelf life for this product, but you've changed the shelf life? So again, we understand the science of it, but it's important to be able to articulate, to allay people's concerns and fears. Over.
Thank you, Honorable Minister. Lots of questions on vaccines and expiry dates today. The next question is coming to you, Dr. Fiona. The second part of Peter's question from BBC is asking, apart from South Sudan and Malawi, does WHO know of any other African countries struggling with expiry dates of COVID-19 vaccine doses? What is WHO's position on the expiry date of AstraZeneca doses, specifically those acquired from AU, which had an expiry date of April 13th? Over to you, Fiona.
Thank you, Mary. And yeah, we are grateful that this question is coming up. I must mention that these doses were actually the doses that originally were in South Africa, the doses that South Africa had purchased, procured for their population, the AstraZeneca doses that they ended up not using. And now the AU through MTN acquired these vaccines to quickly ramp up the vaccination on the continent and give them to 13 countries. And now we have Comoros, which also received those same doses. All the doses had an expiry date of 13th of April. The Gambia, which managed to use up all the doses they received before the expiry date. Togo also managed to use up all the doses. We have Ghana that managed to use almost 95% of the doses they received. Senegal too did receive them, as mentioned by the minister. We had them also in Sierra Leone, in Guinea, and in Guinea-Bissau, and in Mauritania, and in Liberia. So we had a number of countries that did receive these doses. But I also need to add that this is not new. The extension of shelf life of a new product is not something that is new. It has happened in the past and it will keep happening because any new product, we do not know how stable it will remain, especially for vaccines that have so many issues attached to them. And this is something that, as mentioned, the national regulatory authorities of countries have the final responsibility for any post-approval changes to all the COVID vaccines for which that have already been granted regulatory approval, including these COVID-19 vaccines as recommended by the WHO emergency use listing. So the national regulatory authorities in countries will make these independent assessments and be able to make that decision. But we are supporting them, but also letting you know this is not something new.
Thank you, Dr. Fiona. That was very helpful. I'm going to Paul from the Lancet. You wanted to ask your question live. Over to you, Paul.
Thank you very much. My question goes to Dr. Moeti and the health ministers that are represented on this call. I'd like to know the vaccination plans for conflict zones, whether there is a special arrangement to ensure that even though the few limited doses of the vaccines that Africa has, individuals in conflict zones are not excluded. Thank you very much.
Thank you, Paul. Over to you, Dr. Moeti, and then the Honorable Minister can come in from Sierra Leone.
Yes, thank you very much. Within the framework of the vaccination planning that the United Nations is supporting, mainly through COVAX, there have been several streams of work. One is, of course, to advocate with member states, including those that have situations of conflict or displaced people or humanitarian crises, that a certain proportion of the vaccines that are obtained need to be targeting these difficult areas. And then secondly, at the international level, there is also an attempt within the humanitarian work of the UN to advocate for obtaining a certain proportions of the vaccines that are available, including from the COVAX mechanism. I think it's very important that we don't forget that people living under difficult circumstances, circumstances of conflict or circumstances of displacement, can be actually living in very crowded conditions, so that the vulnerability to the virus, if it arrives, is going to be much greater. So we are working mainly through the humanitarian window to make sure that under these conditions, people have access to the vaccine. And then in the same, and then we, in the same vein as providing essential services to people under conflict conditions, we will work with humanitarian partners then to make sure that the COVID-19 vaccination is provided to people under these difficult circumstances.
Thank you, Dr. Moeti. Honorable Minister.
Yeah, I think we'll defer to Dr. Moeti on this, but clearly, not only in conflict zones, but in hard to reach communities, vulnerable populations, especially in the border areas, we want to be sure that we create access to people no matter where they are. And I think in the Sierra Leone context, what we did was to decentralize vaccine distribution to just make sure that every district, especially the high-risk populations, just based on the epi data that we collected, were considered as our priority going forward. We have limited vaccines. Just maybe to plug in at the outset that we still have a large, fairly good quantity of AstraZeneca vaccines that have not expired yet. And that's what we're using as priority in all of these countries as we wait for resolution around the very few that we have that may have expired. Maybe to address an issue that was raised by Dr. Fiona early on, I think for some of these countries like Sierra Leone, the regulatory authorities don't have the capability or the capacity to do intense studies to be able to see if, to make it as a basis of their decision making. They defer to WHO, they defer to your leadership around this. So I would ask that as these contentious and controversial things come up, that you help us by providing us valuable information that we could convert in our own local context to be able to address people's needs. Thank you.
Thank you, Honorable Minister.
Mary, if I could just come in on this, and I agree very much with the Minister on this very varied capacity of national regulatory authorities. We have a mechanism for networking national regulatory authorities so that they work together. It's called a forum, the African Vaccine Regulatory Forum, so that they share their capacities and they look together and they form, if you like, common points of view. I agree with the minister very much that WHO plays a very important role here, and we're working with our NEPAD to facilitate this networking so that not every national regulatory authority has to sit down, do all of this work on its own, and it can accept both the WHO advice and in a way in its, if you like, responsibility to declare to the country what the group has decided as well. So I very much agree that in the past, what we've seen is when there are new tools available, the regulatory process in countries, especially where the capacity is inadequate, can delay the adoption of new tools by many, many months. So this platform is really meant to facilitate that, and just to assure that WHO is very much playing that facilitatory role and providing, for example, the emergency use listing. Once WHO provides this guidance, our expectation is that that's the service we're providing for countries then to feel comfortable to go ahead and use and adopt a product.
Thank you, Dr. Moeti. Now I'm going to Sarah from DEVEX. You wanted to ask your question live. The floor is open to you, please.
Thank you. Can you talk a bit about best management of data in COVID-19 vaccine rollouts, including data around target priority groups, stocks of supplies of vaccines, cold chain data, and ensuring that countries have enough health workers in the right places for vaccine rollouts? How do you recommend countries improve their data management systems, whether it be digitalization or other means? And are there any particular data management systems that WHO is advocating countries use, and how do those systems work? Thank you.
Okay, thank you, Sarah. I'll go to Dr. Moeti first, then the minister can reflect. Fiona, if you have additions, please feel free to comment.
Yeah. I mean, I think I'll just start and perhaps ask Fiona to supplement, and perhaps the minister can give the example of how they're doing this in Sierra Leone. Certainly, when we were supporting countries in their preparation and now in the management of the delivery of the vaccine, there were several pillars of the work in that WHO was supporting countries to carry out, including very much establishing their data collection and data management systems for different aspects of the operation of the vaccine, including estimating the populations to be targeted, for sure, documenting who these are, and then documenting various aspects of the work, including preparing for the documentation of adverse events, for example, making sure that people are provided with a document, either paper or even electronically, to indicate that they have been vaccinated, with the information ensuring that they return for their second dose if that is relevant for the vaccine that they're receiving. So a lot of work has gone into establishing these data systems in countries, and we are receiving information from the countries, for example, about the vaccination that has been carried out, even also on the adverse events that they're observing and tracking. Yeah, so I think it's fair to say that quite a lot of effort has gone into developing these systems, including using electronic means and using technology in order to facilitate the flow of information. So I'll stop here, just acknowledging this is a very critical part of monitoring and managing the delivery of vaccines and follow-up of those who've been vaccinated.
Okay, thank you, Dr. Moeti. Fiona, if you want to compliment, and then I will go back to the minister to tell us how they are doing it in Sierra Leone. Fiona, you are muted. Okay.
Thank you, Mary. Dr. Moeti actually had said it all. Just to mention that we actually have had a lot of investments previously in immunization into the data systems. and that's the pandemic and as just before the vaccination started. And that's the only way we are able to get data here. But when it comes to vaccination of priority groups, we are told that countries are overwhelmed with the vaccination work that is going on. We just have 29 countries that are reporting on the vaccination of health workers. Much as we know, all countries are vaccinating health workers. We have just 25 that are giving us information on vaccinating of people with pre-existing conditions, and just 28 countries that are telling us about vaccination of older adults. I must say this is really substandard reporting. We have about 60 countries that are reporting. We urge all our countries to give us information because we would want to know what proportion of health workers on the continent have been vaccinated. What proportion of the older adults or people with pre-existing conditions have been vaccinated. But I must say, because we have invested a lot in these data systems, countries are now coming up to report more and more. Over.
Thank you, Dr. Fiona. Honorable Minister, please.
Well, thank you very much. I think we'll all understand how complicated this process is. I think for Sierra Leone, we have two vaccines, the Cyanopharma Vaccine and the AstraZeneca product. These have also different intervals between the initial shot and the booster shot. And we're using both of them at the same time, prioritizing different populations. So it's been a really quite challenging data environment to be able to, on the first hand, target the different population groups that you work with, to be able to and who's been vaccinated, and third, to be able to see what the follow-up is, that the follow-up vaccination does occur. We're very pleased that we were able to have an electronic product that is able to capture all of this information with a unique identifier, with unique client information, and such that when you get your second shot, then you're fully certified, and all of that information is in your plastic card. And we collate this information, we're able to utilize it to look at where we're falling short, what areas we're falling short, where we need to intensify and increase our activities. One of the other things that we found extremely helpful is being able to pace the process, because I think doing all these things at the same time could be quite overwhelming. And I think we've been able to pace it on the one hand, knowing that we have some limited amount of vaccines, and we're also afraid that we don't give all of the first shots and not have the booster dose in readiness was. So pacing it and having an electronic medical record system and an electronic recording system has been very, very helpful to us. And I think we're really pleased about that. Also, the really good thing was there was an existing platform that we had with tracking airport entries and exits. And so we're able to, within a week, transpose that platform to be adaptable to using these two vaccines in our population. So data was paramount. It is really important, and we're able to track what we're doing on a daily basis in real time. Over.
Okay, thank you very much, Honorable Minister. I understand that the Honorable Minister of Botswana is unable to take part because of technical problems with connection, so he sends his apologies. To you journalists, please, if you are unable to go live, you can type your question on the Q&A function on the Zoom application. The next question is coming to you, Dr. Fiona. As South Africa is considering resuming the Johnson & Johnson vaccine rollout that was initially paused, what is WHO's recommendation on the jab, since the FDA and CDC recommended a pause on the use of the vaccine because of the rare blood clotting? Over to you, Fiona.
Yeah, thanks, Mary. Yeah, we've actually just heard that South Africa Cabinet has agreed to lift the suspension of the Johnson & Johnson COVID-19 vaccination program, and the health minister is expected to make this announcement anytime soon. And of course, the program will continue as soon as the health department is ready. So the WHO Global Advisory Committee on Vaccine Safety is monitoring closely the reports of the thromboembolic events with low platelets following vaccination with Johnson & Johnson vaccine, and will communicate any findings following this review. We are in close contact with the European Medicines Agency, who are also reviewing this information. With the FDA, we know that the FDA recommended the suspension while investigation takes place, and other regulators are also doing these investigations. South Africa's regulatory authority has also recommended this lifting. As we've heard, South Africa has one of the most robust regulatory authorities, and definitely have studied a lot of this data, especially the fact that they were vaccinating in the context of study in South Africa, not a rollout of the vaccine, but studying the Johnson & Johnson. So they also have data from local data from South Africa that can be relied on from the hundreds of thousands of doses that had been given. So we really know that WHO works together very closely with these regulatory authorities. And also, as I mentioned, the advisory committee is following up this information closely, and we respect and also with support the government of Tanzania and of South Africa in the decision that they have made.
Thank you, Dr. Fiona. And to the journalists asking their question on the Zoom chat, please don't forget to give us the name of the media outlet you represent. Now I turn over to Titus from Botswana Radio that is going live with his questions. Over to you, Titus. Titus, are you there? Okay, you can get ready. Let me turn to the Minister of Health to ask this question first before coming back to you, Titus. Has Sierra Leone been able to administer the Ebola and COVID-19 vaccine at the same time? If yes, what was the experience? Over to you, Honorable Minister Sierra Leone.
So what we're doing right now is, as we actively moving forward with the COVID-19 vaccination, and I think in the high-risk districts where it's close to the Guinea border, we've asked for a small group of healthcare workers who will be dedicated to responding to any Ebola introductions to forgo their COVID vaccination at this point and be ready to take the Ebola vaccines. So I think we're looking to see what the guidance is by the co-vaccination. We're not sure of the science of it at this point. And I think it's being very closely investigated. And again, we'll look for counsel and guidance from not only WHO, AFRO, but also from the region. There's very active engagement between AFRO and Geneva and some of the vaccine experts here who are involved in the micro-planning process. And I think that's the council we have at this point. We'll look to very closely see what the challenges are with the overlap and face this with a little bit more caution. Over.
Thank you very much, Honorable Minister. Dr. Ambrose Talisuna, I'm coming to you with the next question. Can veterinary medicines be used as vaccine or treatment for COVID-19? Over to you, Dr. Talisuna.
Thank you very much, the moderator and the panelists. As you know, WHO had a program to look at whether it is new medicine, but also repurposing some of the medicines that exist to see whether they have any efficacy on COVID-19. And specifically, the medicine that you've asked in the chat room is ivermectin, which is currently an antiparasitic drug. And normally in medicine development, we go through what are called randomized clinical trials, where you compare the repurposed medicine or the new medicine with the placebo to see whether there is a benefit. And I think at the moment, the data all suggests that ivermectin actually, there is no benefit for using ivermectin for the treatment of COVID. So there could be other medicines that will be repurposed. But again, as WHO, we go through the clinical trial development process where we compare the drugs to see their efficacy. Over to you, Mary.
Thank you, Dr. Talisuna. I'll give this question to Dr. Moeti, and the Minister of Health from Sierra Leone could complement. This question is from Al Jazeera. Has the WHO seen an increase in vaccine hesitancy after several countries like the USA have halted vaccinating their population with the AstraZeneca vaccine? Over to you, Dr. Moeti, and the Minister could complement.
Yes, thank you. That's a very good question. I think it's important to say that, from the very beginning, first of all, that there is an active anti-vaccine group that has taken advantage of all the uncertainties, questions about these new vaccines that are being introduced in a very much of an emergency context to spread their message. And there are certain countries where this message has found traction, and there has been a lot of hesitancy, resistance among the population even before the vaccination started. And then certainly when information started to emerge about some of the adverse effects, this has also been observed to increase. And that's been seen in a number of countries in the region as well. But what we had, so I think I'll only echo what the minister has said when he emphasized the importance of communication, simple, understandable information channeled through trusted sources, the networks that people are normally associating with and with whom they are in contact and communicating, including through the social media. So certainly these challenges and problems of the vaccines, certainly seeing one country today decide to pause, another country tomorrow decide to resume, has had an impact on people's readiness to take the vaccine. What has helped a lot in many cases is when people see trusted leaders go ahead themselves. The minister shared with us how in Sierra Leone this was done not only by the head of state, but also by the entire cabinet. We find that that makes a huge difference in giving people a sense of belief and confidence in the vaccines. So in conclusion, yes, there has been some hesitation that has emerged around this information, around adverse effects, but there are ways to counteract it through communicating with people, through sending out information through trusted channels, those who influence their views, and very much through demonstration by influential people, leaders, that they have confidence in the vaccines. They are going to take these vaccines. What's very important is to provide simple, comprehensible information to people so that what starts being spread around is facts in ways that people can understand. Thank you.
Thank you, Dr. Moeti. Honorable Minister, do you want to compliment?
Yes, again, I think in Sierra Leone, it's not just vaccine hesitancy. At the outset, it's actual vaccine skepticism. People really not believing that this is real. And in a lot of cases, they want proof of it. They want proof that this is safe. And so for me, the message is listening to the public. No question is too dumb. No question is too stupid. I mean, if people are telling you what they feel. And in our country context, there are people worried that, oh, this is another public experiment that they want to make on our people here. And that's what you see on the internet. That's where you see in social media. But to be able to prove to them that there's actually a science here, and being able to explain in very simple layperson's terms, and then they say, show me. And then the show me was having the president sit there and take the shot in their arms, And not only that, having the president and the cabinet come back and say, you see, we took it, we're safe. 1 week later, 2 weeks later. I think what that does is build confidence in the community and perhaps help fill that information void that the internet and the skeptics are filling, and being able to really take that off the table. It's also an active process. You cannot let things go. You have to constantly remind people because the messages keep changing. And so we had that with AstraZeneca. We had that with the Chinese Sinopharm product. that people were really, really skeptical about. But now you have a situation where people are stepping up. Even the skeptics are standing in line to be vaccinated. So I think that's real progress, and we shouldn't take it for granted. We should just constantly work on it and show evidence that this is indeed working. Over.
Thank you, Honorable Minister. So the next question is coming to you, Dr. Ambrose Talisuna. And this question is coming from Emerson from Cape Verde. He's asking, Cape Verde has the highest incidence rates of COVID-19 in the continent. What do we need to do to decrease the number of cases, and what are the recommendations? Over to Dr. Talisuna.
I think the question from Cape Verde is valid. First of all, island states actually, we are observing that the island states, Cape Verde, Seychelles, they have a high attack rate just because of small populations. But it's also true that in the last weeks, we've seen 13 countries that are reporting an increasing trend of cases, and these including Angola, Burundi, Cabo Verde, Cameroon, and Central African Republic, Eritrea, Ethiopia, Gabon, Madagascar, Mali, Mauritius, and now Rwanda and Togo. There are a couple of things that could explain that. One is really fatigue with the intervention. I think countries put in place public health and social measures, relaxing those measures. And in order for us to be able to, as WHO African region, I think, support countries to deal with some of these resurgences or whether these are waves. Last week, we issued an interim guidance for dealing with resurgence on the African continent, and stipulates the indicators that we need to track and what we call alert and action thresholds and the intervention toolkit that needs to be put in place. So there might be countries which really have more than 20% increase of cases that they have not observed in the previous weeks, that might need to put in some of those interventions in that intervention toolkit. So I think we shared with all our WRs this guidance document, and colleagues in Cabo Verde can access this. They are both in English, French, and Portuguese, and they stipulate what member states that are having resurgence of cases need to do. Again, some of them is due to relaxation of the intervention measures that we know work for COVID response. Over.
Thank you, Dr. Talisuna. So I'm coming back to Dr. Moeti and the Honorable Minister. This question is from Massimo from Italian Press. Have COVID-19 containment prevention measures been readily accepted by the public? Dr. Moeti, you go first, and then the Minister.
Yes, that's a good question. Also, especially in light of what Ambrose just said. At the beginning, African people really accepted these measures despite the huge difficulties that they caused. I think we've said many times that African governments imposed some of the social measures relatively early, and this has explained the evolution to some degree of the COVID-19 pandemic on the continent. And people did accept to stay at home, to keep their distance, to wear masks. We saw that people even innovated. It was on the continent that we started to see masks being produced by some of the capacity, sort of locally produced masks by tailors, cotton masks, etc. So people did initially accept, and I'd like to emphasize, despite the sometimes huge difficulties that this engendered for their livelihoods, for their daily lives, despite some of the conditions, the living conditions, which are a challenge in some of the low-income urban areas, for example. It has needed, of course, to be sustained. The government's put in place measures to communicate with people, encourage them to continue with the wearing of the mask, the keeping of the distance. They're not going out doing their shopping on certain days. There were curfews imposed that people complied with at the beginning of the pandemic. And then the same as is happening to people worldwide. This has been a quite prolonged experience now, over a year, when some of us expected it to be over within some months at the beginning, there is a certain level of fatigue among people everywhere. And people have demonstrated that in some countries. There are a couple of countries. I have to say, in African countries, the kind of demonstration that we have seen in some Western countries, some of whom which have turned violent, the need for police to intervene has occurred, but has occurred to a much lesser degree. What we are observing is the need really to particularly encourage people to sustain the use of masks. My own observation in places that I've visited is that sometimes this is very variable. In some countries, it has been sustained, and in others, it's been difficult. So I would say overall, yes, African people did accept, and we have estimates by the World Bank of the economic impact of all the measures that had to be taken, including at the individual and household level. But there is need to re-energize, and there is need to constantly support. And I'd like to go back to what the minister said. We need to understand. So we are encouraging countries to go out there, find out from people what's going on. Is it that they're not able to get the supplies they need? What are the difficulties that they're having in sustaining these prevention measures? Because some of these will need to be sustained until such time as we have significant levels of coverage with the vaccine. But on the whole, they did accept. They did play their part, and I believe it has resulted in the kind of situation that is not as bad as had initially been projected and predicted.
Thank you, Dr. Moeti. Honorable Minister.
Yeah, I think Sierra Leone is in a rather unique situation. You know, we had one of the worst Ebola outbreaks in the world with very, very devastating consequences to our people, with over 14,000 infections and 4,000 deaths. People have not forgotten that. They're still hurting from that experience. So when COVID was announced, initially people were a little worried about it on one hand, but they knew what needed to be done. They knew what it involves, really mobilizing people to be able to respond to it. So I think from the Sierra Leone perspective, it was very early adoption and implementation, and we actually quickly reactivated all of the structures that we had. We quickly reactivated the coordination mechanisms that we had in country, and that proved to be very, very helpful in getting the communities involved fairly early. The challenge we have is that people were thinking that it's going to be as bad as Ebola, and so it not being as bad as Ebola tempered the enthusiasm a little bit more to just say, well, this is not as bad. And our worry is that how do we sustain that interest and energy and make sure people don't let their guard down, so that if there's another wave, that we're able to quickly respond or continue to respond. I think a lot of the interventions that were applicable to Ebola were applicable to the COVID-19, except for the additional mask component. And I think also just listening to the people, people realize that it's inconvenient, it's difficult to wear. And I think that's where we've had the biggest challenge. So people are wearing their masks as adornment of the chin and a new fashion statement around, instead of going back to the real reason why they're using this. So our worry is not getting into fatigue on the one hand, but really reinforcing interest in letting people know how well they've done so far, how good they've been in their compliance. And even with the restrictions and the challenges associated with that, it requires quite a bit of hydraulics. How do you get the balance right between restrictive measures on the one hand that would not lead to revolt, at the same time allowing people to live their normal lives, so that people say, I don't want to die from hunger and starvation, instead of COVID. And so getting that balance right has been a challenge for Sierra Leone, but I think we've navigated it well so far. Over.
Thank you, Honorable Minister, and thanks to all the panelists and the journalists as well. We are coming to the end of this press briefing. So I'll come back to you first, the Honorable Minister, for your final thoughts before Dr. Moeti. But before your final thoughts, if you could answer this follow-up question from Esther, and then you give us your final thoughts. The question is from Esther, is how many health workers had to forgo COVID-19 vaccine for Ebola? And then after that, you can give us your final thoughts. Thank you, over to you.
Yeah, I don't have the exact numbers, but it's a very limited number, especially in the high-risk border districts that are close to Guinea, especially in a place called Kailam district and Kono. Kailam and Kono were places where the last experience was a spillover of Ebola from Guinea to Sierra Leone. So I'll get the exact numbers for you, but it's a smaller proportion of the overall healthcare workers. In terms of a final statement, I would just say I want to thank Afro for your leadership in helping bring everybody together. You know, as I say to our colleagues, WHO is the Ministers of Health, Ministry of Health. So we look to you for guidance, we look to you for your counsel, we look to you for leadership. I think what has happened with COVID-19 here in Sierra Leone is that we've really rallied people around. We've got them engaged. They were skeptical initially, but now they've accepted the vaccines. They're seeing how it's going. They've seen that all of the scares about adverse events, we haven't recorded any major adverse events out of the 50,000 plus that we've vaccinated. And so there's a really high confidence level now. What we don't want to do is disappoint people and go to a point where we say we run out of vaccines. So in fact, that's why we calibrated our initial start. We went in slowly, but people want the vaccines now. And if they want, and we open it all up and we're not able to meet the demands, it has major implications for us. Secondly, just making sure that as we roll out these vaccines for Ebola and for COVID-19, we want to be sure that the experience is lasting and it doesn't create any negative impact on our routine vaccination. Because anything that goes wrong with this adult vaccination that we're doing now will have major impact on our routine infant vaccination. So let's continue to communicate, let's continue to work with each other, let's be able to anticipate problems and work with communicating with the public, knowing what we know, knowing what we don't know, and what we're trying to investigate on their behalf. I think it will make a really formidable experience for us as ministries, for WHO, and for the people we serve. Thank you.
Thank you, Honorable Minister. And now over to you, Dr. Moeti, for your final thoughts.
Yes, thank you. Thank you, Mary. First, a huge thanks to the Honorable Minister for having joined us and shared your perspectives, the experience, the very positive and encouraging experience from Sierra Leone with us. And thanks again to our colleagues, the journalists, for having joined us. I think as a last message, I will, I'd like to step back from the COVID for a minute and say that we still have millions of African children who are not yet being reached by routine vaccination, when we have seen how hugely it can have an impact on the number of children that are dying. So these numbers are really inspiration to us, an inspiration to families, to mothers, to fathers, to bring your children to be vaccinated. We know that there are families whose circumstances make this difficult. So it's to encourage the healthcare workers at the local level, the community leaders, to try to find those children, to adjust the work that we are doing so that no child misses out on being vaccinated when these programs are available in their countries. You know, it's very much a right of a child, and it's our obligation as leaders in health and as parents and families to make sure that our children benefit. It's such a fabulous public health tool. And then finally, on coming back to the COVID, to echo the minister and encourage our people very much, despite the challenges, despite some of the scary stories that are circulating, have confidence in the fact that the national authorities, WHO, as is our job, the international global health community is putting a lot of effort into studying the data about these vaccines and making sure that anything that is proposed to people is worth the effort, is safe for people. There's been a lot of discussion about weighing up the risks and benefits. And here I'd like to emphasize again that even if the story of some side effects, some harm done by the vaccine gets out very, very loudly, if we look at the numbers, they are tiny. It's still worth taking these vaccines. And then finally, let's make sure that those people who are most in need, the healthcare workers, the elderly or older people with some illnesses which make them vulnerable to severe forms of the illness, get their vaccines first. And then when it's our turn, please let's show up and take the vaccine, because it's for the common good. It's for the good of all of us, our families, our communities, our countries, and for the whole world as well. And then a final word on the solidarity. We will continue to advocate for the sharing of vaccine supplies so that countries in Africa which have received some vaccines but need to catch up, continue to be supported to speed up the vaccination. So thank you all very much for having joined us today.
Thank you very much, Dr. Moeti. A very big thank you to our fantastic panelists today and all the journalists that joined us for this press briefing. For those that would like to ask more questions in French, Dr. Ado will be online for a few more minutes to answer your question. Thank you and see you next week.
Oui, bonjour à tous. Nous allons donc poursuivre un peu cette conférence de presse en français avec, j'espère, le docteur Ado Bouaka qui doit nous rejoindre. Nous n'avons pas beaucoup de questions. Nous avons une question d'une docteur Ado Bouaka, j'espère que vous m'entendez, qui est donc chef de l'équipe de l'unité maladies évitables par la vaccination au bureau de l'OMS. Nous avons plusieurs questions d'une journaliste, la journaliste Ndiaye Kadi Diop du blog Santé et Sécurité Pratique au Sénégal. La première question concerne la production actuelle de... Bonjour docteur. La première question concerne la production de vaccins contre la Covid-19. Y a-t-il de nouveaux vaccins qui arriveront bientôt? Avez-vous entendu ma question?
Oui, merci beaucoup et bonjour. Et merci pour la question. Comme vous savez, il y a beaucoup de candidats vaccins qui sont encore au stade expérimental ou au stade d'essais cliniques. Donc, il y a sûrement beaucoup de vaccins qui sont encore à ces stades-là, qui sont en expérimentation. Et il y a une équipe de l'OMS qui se charge de suivre ces processus jusqu'au moment où les industries qui fabriquent ces vaccins soumettront leur dossier à l'équipe de préqualification de l'OMS pour que cette équipe évalue ces vaccins et les approuve pour leur utilisation. Merci.
Merci beaucoup. La seconde question est un peu plus technique et concerne la pharmacovigilance. Est-ce qu'aujourd'hui, il est possible d'administrer les vaccins contre la Covid, plus précisément en fonction de l'âge et des antécédents des patients? Est-ce qu'il est possible de cibler l'usage des vaccins?
Oui, donc des vaccins qui ont reçu l'autorisation d'utilisation en urgence par l'équipe de préqualification de l'OMS. Cette équipe a fourni, aussi bien que le comité des experts de l'OMS, donc cette équipe a fourni des directives pour l'utilisation des vaccins qui ont obtenu ces autorisations d'utilisation en urgence. Par exemple, le vaccin AstraZeneca qui est utilisé couramment dans les pays d'Afrique sont des vaccins qui sont utilisés pour des personnes qui ont des comorbidités, donc notamment des maladies cardiaques, des maladies rénales, l'hypertension, le diabète. Donc, ces vaccins-là sont utilisés pour ces personnes-là parce que ces personnes-là présentent une certaine vulnérabilité, un certain risque élevé de contracter le virus de la COVID-19. Les personnes âgées aussi sont indiquées pour recevoir ces vaccins. Donc, au-delà de 50 ans notamment, ces vaccins sont prescrits pour ces personnes qui sont âgées. Merci.
Merci beaucoup. Et la dernière question concerne un autre vaccin. Il s'agit là de la vaccination contre le cancer du col de l'utérus chez les jeunes filles, qui, paraît-il, fait l'objet de polémiques. Peut-être que vous pouvez nous éclairer là-dessus. Est-ce qu'on peut avoir une idée du taux de couverture actuel par ce vaccin?
Oui, merci. Donc, il s'agit, je crois, vous faites allusion au vaccin contre le virus du papilloma humain, que nous appelons VPH en français ou HPV en anglais. Donc, c'est un vaccin qui est indiqué pour être utilisé chez les jeunes filles, idéalement avant qu'elles à l'âge d'adolescente, donc avant qu'elles ne commencent à exercer une certaine vie ou une activité sexuelle, notamment à partir de 9 ans jusqu'autour de 14-15 ans. Donc, ces vaccins-là sont efficaces, les études l'ont montré, et ils sont utilisés pour prévenir les cancers du col utérin. Vous savez que c'est un des cancers les plus meurtriers et les plus fréquents, surtout dans notre continent aussi. Et donc, ces vaccins est utilisé dans plusieurs pays. En Afrique de l'Ouest, nous avons, par exemple, autour de 6-7 pays qui ont déjà introduit ces vaccins dans leur programme de vaccination de routine. Et donc, ces vaccins marchent et les études le montrent. Donc, je pense que la désinformation qui tourne autour de ces vaccins n'est pas fondée. Et donc, nous comptons sur vous, les médias, pour sensibiliser les communautés et montrer l'importance de cette vaccination au regard du danger que présente les cancers du col utérin. Merci.
Merci énormément pour ces clarifications. Dr Rado, nous avons fait le tour des questions qui nous restaient à adresser. Donc, merci énormément de votre disponibilité. Et je vous donne rendez-vous à tout le monde donc, à la semaine prochaine. Merci énormément.
Merci et merci à vous tous aussi, à vous toutes, et bonne journée. Au revoir.